Okay, kids, hello. I'm gonna tell you quite small lecture for next topic. The hospital hygiene, our topic for today. So, by the way, we have lots of things what we must discuss, etc. But before, when we do it, I must give you, kind of theoretical material. So, and first of all, when I will talk about this topic at the practice classes and so on. Our thought. This is actually our patient and a building. So, and how they are communed together. So, first of all, about patient. So the patient care institution, right, site of development area, right, is selected and taken into account on the several zones. What mean a zone? So, and reasons. First, it's distance from their furthest settlements of their population service zone, for example. Then, so what's mean? Mean like land plot must be connected with the population service zone. This means like the patient must be taken to the hospital in no more than 30 minutes, so up to half hour. So it's mean like working of the ambulance ride plus emergency care reaction, etc. Next one. This is mean a distance from the possible air or soil pollution sources. As we talked a little bit about noise, I told you about some kinds of the vibration, etc. The emission of the industries, what can be in this care, allocation or dislocation so close to the airports or the railway station, speed highway or the highway can be overloaded with the traffic jam, etc. So must be taken into account these their sanitary and protection zones and wind rows. So our hospital, simply say, must be allocated separately. So means so far away, right, from the source of pollution, etc. So next one, we will be orientated of the windrows. So what does mean a windrows? We talked, it's like standard ramp, north, south, west, east, etc. Understand, right? What does mean? So this is like usage of the orientation of the windows or of the windows. So we talked, actually it was a second class in this semester about the wind orientation. It's up to solar radiation, etc. But before when we do that, we must talk about the green area. So what's mean a green area? This like kind of location of their bushes, their park, or wood trees on the ground, of course on the territory of the hospital, etc. So next one, next one? The flat countryside of the flank of the hill towards of the southern points and others. So next moment, what we've got, this is a simple classification of the hospital like a building. But before, when we classified our area, must be selecting the one should be taken into the consideration the possibility of the hospital construction, joining the examine system of water, sewage, electricity, gas and heat supply, the passage and drying convenience, etc. So next one, the systems. How we can classify it, actually hospital buildings. So by the way. By the way, we've got the centralized, decentralized, and mixed. Okay, so actually, these understanding you have heard because we talked about that, about the water topic, if you remember. So same words, but a little bit quite different sense. Because first of all, the decentralized, I want to pay your attention about decentralized, or second name of this kind of type of building, we call it the pavilion type. So when each department is situated in the separate buildings, so this is mean a decentralized type of water, oh, I'm sorry, hospital hygiene. So next one, centralized blocked system. So this what's mean? What it's mean like when the all departments, right, are situated in one building. So it means what? It's mean like every single floor. It's mean one building, for example, no more than 9 floors. Yeah, fill it up by the means departments, etc. Next one, mixed type. Mixed type. Okay, when the majority of the departments are situated in the centralized building, right? But some separate ones, like the infection disease department, or pediatrics, or kind of psychiatric departments, etc., right, in the isolated buildings. Understood, right? Okay, so what's the positive? The positive features of the decentralized system are in the possibility of the patient to stay more outdoors. Okay, so and drawback is the difficulty during the usage of the diagnostics, right? Psychotherapeutical measures or their doubling, so which increases the capital expenditure, etc. Understand? Okay, so then I want to pay your attention about land area. So land area for the hospital is actually subgroups is increased compared to the data from the table. So for example, we've got at 15% for infection or the oncological hospital. We should do give area percentage like that. Next one, the 25% at 25% for the departments of adults rehabilitation, like that. So next one, a 40% for departments of the children's rehabilitation. So the possibility to within or the reconstruct for hospital group for building, right, should also be taken into account. And so the drawback of the centralized system is the difficulty of the nosocomial infection prevention measures. So decreasing the time of the impossibility of the patients to stay outdoors. So the mixed system, when the infectious, the psychiatric or a children's or pediatrics department are situated in the separate building, has not be a movement, so drawback, and that's why it is the most suitable. So the side land project of the patient's care institution, they includes the following zones. Okay, about zones, we've got what? A zone of the patient care building for a non-infection patients. So next, it's a zone of the patient care building with infection diseases. Next one, polyclinic zone. So next, this is a zone of morbid anatomical departments. So in other words, it's autopsy. The household zone and landscape zone. Okay, the infection, obstetric, pediatrics, tuberculosis, and the psychiatric department, they should have the separate landscape zone of their own. Pay attention on this moment. So the hospital site housing density, depending on the amount of the beds, should not exceed like 10 up to 15%. So then up to 60, up to 65 of the area of the should be occupied by all kinds of green area. But I tell you what, more than 50, you should to remember these standard. So the size of the landscape zone should be not less than 25 square meters per one bed. Next moment, the distance between the hospital building should be following between the walls with the wards and doctor's room windows at 2.5 of the opposite building height, but not less than 25 meters. Pay attention. Then, between the radiological building and other ones must be a distance 25 meters. The morbid anatomical or autopsy building and the household one at the distance of the 30 meters from the other building, residential including. So between the buildings are flanks not less than 30 meters from the polyclinic, women's consulting center and health center not less than 15 meters. So the admission department for somatic patients in the centralized building actually and the rooms of the patient discharged should be joined together and should include first thing, this is the examination room, sanitary inspection room, the wards for the temporary admitted patients, right, stay there, the intensive care room, sometimes the x-ray room. So there should have be I mean the separate admission and discharge department for the children's obstetric, infection and dermatovenerological, tuberculosis and psychiatric departments. So the admission departments area depend on the amount of the patients supposed to be admitted during whole day. Means what? Means 24 hours. The sanitary inspection room is planned according to their current principle and consists of the examination room, the bath and shower room, dressing room, etc. So in infection department, the dermatovenerological and tuberculosis department, the admitted the patient, the clothing is there referred to the disinfection department, with each situated in the separate building without the household zone. For example, and last one, appendix of that, this is the laundry, the central nutrition unit, the boiler room, garage and other hospital premises are also situated within the household zone. Okay, so pay attention about couple words. What's the main negative impact, for example, of the centralized type of hospital? One of them, this is a spreading of nosocomial infection. So in nowadays, so actually now, you've seen troubling whole world or actually global trouble about COVID, right, 19, etc. So same trouble if, for example, today will be absolutely calm, nothing of infection, but unfortunately nobody canceled nosocomial infection. This is trouble every year. The humanity has got trouble every day when human being have been alive, etc. And actually now alive, and etc. So anyway, we must to fight with that, and we've got lots of things what we can do. Actually, we will talk more intensive about nosocomial infection next lecture. I tell you what. So basically, what will be about couple words about beds, about patients, etc. So each hospital department actually, right, is intended for the patient with the similar diseases. Okay, so it should include a ward section for a 25 up to 30 beds, with the 6 up to 8 wards for a 2 to 4 beds, with the area of the no less than 7 square meters per one bed. So no less than 2 wards for one bed, with the area of the 9 up to 12 meters. So pay attention. But this is area for infectious patients, and with the cubic capacity of 20 up to 25 cubic meter for each patient, and the ventilation volume must to be 40 up to 45 cubic meter per hour. So means air exchange in the room. Except the wards, in the wards of the sector, there should be room patient the daytime. Stay the area up to 25 square meters, and so on. So next one, besides for the canteen, for the canteen, there should be a bar with the two ward section with the area of 18 square meters. So about windows orientation, actually, if you remember, we talked with you about that at second topic, when we talked about lighting, natural lighting and artificial illumination. So pay attention about orientation of the window in the northern hemisphere. Northern hemisphere. Pay attention, students, what it is in the southeast or south. So, but there should be a 1 or 2 words with the orientation towards the northern points for severely ill patient, of the patient with fever. So the beds should be locked parallelly to the light, a conductive wall for a patient to be able to tongue back from the dazing effect of the direct solar radiation. So it's like kind of features, pay attention. So the natural light indices near the internal wall, there should be the following: the day line factor. So like 1.5% the lighting coefficient. So you should remind what we did last classes, how we can count, etc. So, and for the artificial illumination, for artificial lighting, let's be honest, there should be in general, right, 60 luxes, and the night light must be 10 up to 15 luxes, with the lamps in the lower part of the wall. Okay, next one, the woods ventilation. The woods ventilation should be achieved by the means of the exhaust ventilation duct. So, what mean these shifts? So, the presence of the window levers and window which can be opened. So the modern hospitals, they should be equipped with the air conditioning. This is the best decision, actually. So in the infectious diseases, the units of the following rooms, they should be equipped. So means one is box type wards with every bed isolation. Anyway, this is the best one. The next one is the semi-box. So semi-box, it's what's mean. It's mean the isolated wards, wards are with the common lavatory and or general lavatory. It's between two rooms, for for example, same lavatory and bathrooms. And the absolute boxes, the isolated wards with the lavatory and bathroom together, so means that. Next one, the operating block, what it is. So operating block of the surgical department, they should be situated in the blind-ended projection or in the separate outhouse of the hospital. So in the operative block, there should be the following rooms. The operative room, pay attention, 30 square meters on the basic of the 30 up to 50 surgical beds in the department. So for the complex operations, for example, 45 square meters. The pre-operating room, the area 10 up to 12 square meters. The sterilizing room, 1 for 2 operating ones. The anesthetic room, 15 square meters. The instrumental room, the surgeon room for the protocols, etc., the laboratory of the express test, the plaster dress room, the room of the mobile diagnostics or emergency diagnostics, the apparatus and the anesthetic equipment, their premises for the sterile and using the operating lines, the washing and the shower room for the operating brigade, and the post-operative residual wards, the lavatories for the personnel, the operating nurses room, and the other depending of the surgical department type. So I will ask something about this kind of actually, let's be honest, this is like a set of premises. Okay, so I will ask one of the part of set of premises in case of the control, and or this is information or kind of question can be in the MCQ, let's be honest. So lots of students actually love surgery, and for them actually this will be so useful, etc. So in the surgical departments, there should be pure and purulent dressing room actually. So there are some peculiarities of the children's department or the pediatrics department, and the hospitals, the tuberculosis, the psychiatric, and the other specialized patient care institution planning. So they are explained in the normative documents and can be learned if it necessary. So next one. Let's give you example about infection disease hospital. Okay, couple words. So pay attention. Standards. So one infectious ward must has uh, minimum 12 square meters. I tell you what, I'll ask you that, and this is like a basic information, by the way. So next one about regional hospital. So for example, let be the 510 beds with the polyclinic for the 1,000 visitors per shift. So what's mean? So an explanatory next one. This as the regional hospital. So this should a group like of the buildings of the 510 beds, or with the polyclinic of the 1,000 visitors per shift in the center of the providing the population with the high qualified medical personnel. So it is the obligate to serve the district town and the district itself with the population up to 100,000 people. So taking into account other existing district hospitals. So the group of the buildings consists of the central building for 450 beds. It's mean 9-story one. So the infectious one for 60 beds. The polyclinic or the outpatient building, the 2-story one. So and etc. So the polyclinic for 1,000 visitors. The per shift they should provide medical assistance to the population up to 40,000 and to provide them with medical consultation, etc. So the hospital in the organization of the medical and consulting center for the patient care institution of the entire district. The hospital comprise 10 departments which are listed below. So, I want to tell you about the treatment and accessory of the premises. So, the hospital comprise so the central building and the intensive care units, the rehabilitation, X-ray, admission, and administrative departments. So there are the operating block and the clinical diagnostic right laboratory. So this project can be used within the first B and 3 climate zones. So to build the hospital group of the buildings, site with the area of the 7.3 hectares is the required. So the hospital territory is divided into the following zones. The inpatient, the outpatient building, like the polyclinics, for example, and infection disease units, the household and accessory premises, and the landscape area. So pay attention. I'm gonna tell you. Distribution to the every single floor of the centralized type of building. Okay, centralized type, it means centralized hospital. So the centralized building departments should be occupied by the further floors. So first floor, actually, I tell you what, ground floor, this is like, like just enter hall, nothing allocated except of the cafeteria, etc. So hospital start from the first floor. So ground floor, this is first in our country. So pay attention because some of you can be in like misunderstanding, so I want to prevent this point. So first floor, the obstetric department, there can be the children's department for the 30 beds for the patient till 1 year, right? The admission department and the central hospital entrance. Okay, but was a mistake because central hospital entrance must be on the ground floor. Okay, second floor. The rehabilitation, obstetric and the children's children. So for 30 beds for children till age 6 years, 6 years old. So etc. Third floor, the rehabilitation intensive care and children's for the 30 beds for the children after 6 years old. Next one, fourth. So the fourth floor, the therapeutical department that consists of the two sectors for the 30 beds and the rehabilitation. So fifth one, so fifth floor, the neurological department for 30 beds, the therapeutic section for the 30 beds and the X-ray department. So sixth floor, actually the functional diagnostics department. The gynecological can be same and consistent of the two section for the 30 beds. Next one, the seventh. So seventh floor, the chemist shop, the otorhinolaryngologist, department for 30 beds and the ophthalmology. once for the 30 beds as well. So next one, this is the 8th floor. So 8th floor, the surgical department, right? The consisting of the two ward section for the 30 beds and the clinical diagnostic laboratory. So the next one, this is the ninth. So the ninth floor, the trauma or traumatology units for the 30 beds and the operating block. Like that. This is a quiet example for our simple hospital. And pay attention. I showed you actually only 9 floors. 9 floors. So this is like a standard in our country. No more than 9 floors must be. So the another moment of the hospital hygiene. So the treatment and diagnostic departments are situated on the each floor near the inpatient department and are interconnected with them. So the ward section have a short main corridor, delighting on the each side, and the place where the corridors are crossed there should be projected halls of the daytime stay and the nurses of the duty station. So next one, this is the infectious diseases unit for 60 beds. So means one flank actually, and the semi boxes of the section for the 30 beds, another flank are situated. So the morbid or okay autopsy. We said autopsy. It's mean what? It's morbid anatomical department. Is the projected in the separate isolated building. So the household block is same projected as the isolated buildings and the household yard where the central heat post, boiler house, the garage, the workshop, the laundry, and the nutrition unit are located. So the hospital is the projected in the skeleton breathing wall, the consisting of the 204 series, but this is not super important, just for general development. So next one, the hospital buildings are provided with the central water heating system. So the tidal exhaust mechanical ventilation, the hot water supply from the boiler room, the electricity supply from the transformer substation, right, and low current from the district telephone station and internal telephone system. Okay, kids. So for how we can do like couple complete words. Okay, so classification, right? I will ask you classification. Three types of hospital we have got: centralized, decentralized, mixed. Types of words what we've got, you remember. So this can be anything: infectious, therapeutic, pediatrics, etc. So I will ask about separate one. I will ask you about what's mean a box type, what's semi-box, etc. I will ask about the corridors, etc. So pay attention. This are quite difficult moment actually, because lots of my actually students don't want to learn it, but actually lots of question will be in kind of control and exam. So few words about actually planning. Okay, so if we are speaking about the regimen of the exploration of the medical inpatient subdivision, so I want to talk about not billing, I want to talk about people. I mean patient, doctors, etc. So in the should be noted in the main requirement concerning for the favorable influences on the patient treatment efficiency and the condition of the medical personnel. Labor consists in the maintaining of the optimal microclimate conditions. So, for example, the rational heating of the premises in the winter, and air conditioning in the summertime. So, the optimal air temperature in the wards in the winter and during the transitional period should range from 19 up to 22 degrees Celsius. Celsius degrees, I'm sorry. So the relative humidity should be what we have said at penultimate classes, 40 up to 60 I'm sorry, percents, right? Percentage. So the air movement speed, pay attention. So we've made conclusion about point 0.2 meter per second. So in hospital, of course, this can be like a standard, but I want to ask you to learn point 0.1 meter per second. So in the nursery post-operative wards, the burns units, and in case of the fever of the infection patients, the air temperature should be higher, because unfortunately they have got a fever, so we cannot make like, like a waterfall, fall of the temperature between, like, can be in ward 18 but patient got a fever 40, unfortunately. So how will they survive? Nothing. So the temperature in these kind of wards must be up to 25 degrees of Celsius, but no less than 22. And for the patient with the thyrotoxicosis, must be lower, so 18 up to 22 degrees of Celsius. So it's another kind of, another side of the hospital hygiene. Actually, this is the standards what we've made at classes of the microclimate, and we talked about that lots. So I just want to ask you to repeat this kind of information. Pay attention this moment. So for efficient patient treatment and the medical personnel labor, the air cleanness in the wards, operating, dressing, a procedure room, and other is the great importance. So the allowable carbon dioxide concentration in the hospital premises, the BNN index of the air pollution by the vital functions products of the patient and personal, so the excreted by the skin during the breathing, right? Also with the dust and microorganisms, there should be range within the limit of 0.07 up to 0.1%. So, indexes of the hospital air pollution, such as the air oxygenation, pay attention, 20 up to 24 milligram of oxygen per cubic meter, and the microbial figure must be 5,000 up to 1. Oh, I'm sorry, 500 up to 1,000 thousand per 1 cubic meter in the operating room, and up to 3,500 per per cubic meters in the just simple words. They also have been calculated and scientifically substantiated. So pay attention. So in the operating room, the concentration of the anesthetic preparation is also standardized. So the isolation and its ultraviolet components of the great importance. Because what? Because therefore the majority of the windows, the more than 50% face towards the southern, east, and south. So the having less than 50% of the windows with the northern or northeast or northern western orientation is there permissible in the geographic latitude of Ukraine. So pay attention of this moment. So about artificial illumination, I tell you what, lamps must be what we've got a standard. So actually I told you lamps I want to pay attention. Lamps produce 100 luxes. So pay attention. No more than 150 luxes. It's about in the procedure, planning and dressing room. Pay attention. So in the operation room must to be 200 up to 1000 luxes in the operation room, because you need like a clean field, when your operation table, etc., you know the visibility, and to maintain your correct and progressive work capacity, etc. So that's why we use this standard, etc., to soldiers in the operation room. So illumination by the luminescent lamps in the abomination room should be twice as higher. Okay, so to combat with the noise is also of the great importance of the hospital wise. Of course, pay attention. So noise. Actually, we will talk next semester about noise, and we will make a decision and a conclusion about noise. But now, this more than enough. Okay, so what's a next moment? Next moment. So occupational exercises. Okay, so exercise. So load and hazard of the surgical specialist doctors include. So the numbers of the surgical intervention up to 150 per year in the general surgery, 170 in otorhinolaryngology, 370 in the obstetric and gynecology or gynecology. The number of the complexity of the operation increase with the rising of the level of the surgeon skills. So pay attention. It's actually we're talking about your like a skill table, like that. So next moment, the forces body position with the trunk frontal bending and the prolonged the static tensor of the muscles of the shoulder, girdle, and back, and the stretch forward arms. So it's mean what? It's mean like soldier standing whole like couple hours, move less, and just like strain position, etc. So same effects in the future will be. Then next one, this is the hot microclimate of the operating room with the high streams of the radioactive heat from the artificial light source. Actually, what it is the shadowless or no shadow, or we can like or without shadow lamp. Okay, but in classification we call like shadeless lamp. You've got it right. It's like looks like the hemisphere, hemisphere with the lamps everywhere. So no shadows will no shadow will be if you use this lamp. But this lamp produce lots of heat. So same, you've got side effects. So next one, the ionizing radiation during the X-ray examination, especially in the traumatology, vascular surgery, and neurosurgery. Okay, next one, the toxic effect of the narcosis agents. So what's mean like the halinate, the chloroform, etc., and anesthetics, and so on. So you see another influence. So the high mental and neuroemotional exertion. So unfortunately, all doctors has got trouble like that. Have got trouble like stress. So that's the point. They connected with the complexity and duration of the surgical intervention, the possible post-operative complication, and responsibility for the patient life. So same stress you see. Another amount of diseases that are filling the surgical specializers, doctors with a temporary disability. The most widespread are there diseases of the nervous system, the cardiovascular system, digestive system, and acute respiratory disease, unfortunately. So next one, this amount of the chronic disease of these, especially such disease as the disease of the cardiovascular system, they connected with the high psycho-emotional or the physical overload, so should be maintained. So we must prevent this kind of disorder. There are the anginobacteria, so you know what I mean. So then hypertension, the vegetative vascular dystonia, and neurasthenia, etc. So there are the frequent diseases due to their prolonged standing at the surgical table. We talked a little bit about that. This actually like osteochondrosis, dyskinesia, varix dilatation of the lower extremities, so extremities, and radicularis. Pay attention. So a surgeon's disability or the necessity to change their occupation in the 60% cases can be explained by the chronic intoxication with the narcotic agents and anesthetics in the 20% cases. So by infection disease can be and physical and nervous over tensor, etc. So this is a quiet example to you about labor. So next one, what about hygienic peculiarities of the labor condition and the health status of the therapeutic doctors depend on the patient service forms. So in the case of the polyclinic district services to the landing role belong the excess physical load. So with the depends of the year, seasons, etc., the size of a doctor district, type the buildings where they work in, etc. So occupational, I want to pay attention about occupational disorders. So occupational diseases. So there are therapeutic doctors. First of all, this is the infections, unfortunately infections. For example, this is the we talk I show you this information. I wanted to repeat. It's pediatricians. Pediatricians. So it's doctor who treat tuberculosis. Pay attention. So specialist in the skin and venereal disorders. So pay attention. This is helminths. So can be risk of the helminthosis. The laboratory assistants at the bacteriological or virological or helminthological laboratories include the corresponding infections. So pay attention. X-ray doctors, radiologists suffer from the dermatitis, eczema, toxicodermia, melanoma, scastoris, leucosis or the leucosis, the skin cancer, etc. So pay attention. This is a hazard and actually professional or occupational disorders or disease what our doctors, our colleague can get actually, and unfortunately they will get. And our job and my job and your job, if you will be hygienist, this is a prevent these kind of disorders. So pay attention. And of the one of the main occupational hazards for dental doctors, so it's mean dentist is there the forced standing with the bending and the turning trunk position with the leads to the prolonged static tensor of the corresponding muscle groups. Noise, pay attention, because turbine or turbine produces noise, and vibration due to the drilling machine or turbine. I said drilling, turbine, it's the same sense actually. So blinding effect of the photopolymer lamp, like example, penetration of the mercury fumes from the mercury amalgam into the respiratory organs. You got it? Fumes of the polymer material solvents danger of the infection from the patient with the upper respiratory tract disease during the incubation of the convalescent stage. Okay, so while performing the manipulations, the connected with the patient's mucous membrane or a blood contact. So pay attention. Okay, so this is a last one, a moment what I want to say to you. So this is over. So I want to tell you thanks for your attention. Please read a book. You can find those kind of information in the book actually, or on the internet. But if you want to search something or find something on the internet, and pay attention, you should to find which source has been used, because uh, anything anybody can write, can tipping on the your uh, board, okay, etc. Anything, so pay attention. You need substantiation. This is a book. So wish you good luck. Thanks for attention. Bye bye. Cheers.